Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to get into my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of the videos that you may see where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student have been discussing cephalosporins. Cephalosporins are used to treat all of the following except is it A, skin infections, B, soft tissue infections, C, gram positive and gram negative bacteria, or D, otitis media? Take a moment and tell me what you got. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is being asked. So here, the stem of the question states cephalosporins are used to treat all of the following except. And I tell you, if you see the word except, we're looking for the incorrect answer. So, cephalosporins, what are they not used to treat? Do we utilize cephalosporins for the treatment of skin infections? Yes, we do. How about soft tissue infections? We also utilize cephalosporin for that. Um, C, gram positive and gram negative bacteria. We do use cephalosporin for those as well. So your answer is D, otitis media. We don't typically utilize cephalosporins for the treatment of otitis media, but cephalosporins are utilized for skin infections, soft tissue infection, pneumonia, meningitis, gram positive and gram negative bacteria. So, there's 5 generations of cephalosporins. So make sure you familiarize yourself with it. Don't sit here and try to know them all. We know if you see Ceph in it, it's in this category. So learn to group your drug classes together and see an overall picture of them so you're not being overwhelmed with all of the medications. All right, question number two. The nurse practitioner and NP student are discussing adverse effects associated with cephalosporin use. All of the following are adverse effects of cephalosporins except, and I'm going to read this one more time. The nurse practitioner and NP student are discussing adverse effects associated with cephalosporin use. All of the following are adverse effects of cephalosporins except is it A, lack of appetite, B, nausea and vomiting, C, anorexia, or D, nephrotoxicity? Take a moment and tell me what you got. All right, so here the stem of the question states all of the following are adverse effects of cephalosporins except. So again, looking for the incorrect. So what is not an adverse effect of cephalosporins, right? So lack of appetite is an adverse effect associated with nausea and vomiting. My rant and my spiel when we're talking antibiotics, typically GI issues, upset, abdominal pain, nausea, vomiting, diarrhea are associated with all antibiotics. Okay, so if you see that when in doubt, you should know it's associated with it. C, anorexia. Nope. Anorexia is not an adverse effect associated with cephalosporins, and D, nephrotoxicity is. You do want to be careful that if you are on a cephalosporin and a patient may already be on furosemide, Lasix, that pay attention to their kidney function because this can cause nephrotoxicity. Also, sidebar. Cephalosporins can cause adverse effects to the clotting times, like your PTT, your PT. So you want to be careful with patients who are on warfarin because it also affects, like I said, the clotting rate. So it can affect vitamin K if they're taking that, but it also can affect how warfarin or Coumadin um, is thinning the blood as well. Okay, so if they're on that, be careful and watch their levels closely because this can alter it. And then lastly, question number 3, what is a contraindication of cephalosporins? Is it A, hypertension, B, pregnancy, C, asthma, or D, anaphylaxis to penicillin? Take a moment and tell me what you got. Okay, and so this question, the stem is the question is the stem. What is a contraindication of cephalosporins? And in this case, the answer is D, anaphylaxis to penicillin. And I'm going to tell you why. And if you were thinking pregnancy, pregnancy is not a contraindication of cephalosporins. Um, of course, they do try to pinpoint based off of the 5 generations, but just as we've gone through several drug classes of antibiotics now, the only other drug class that I told you guys that was safe for pregnancy and lactation was penicillin. That's the one that's considered safe. Cephalosporins and penicillins are those drug classes that you typically I say they're family, right? Because if you have a penicillin allergy, you're taught to assume that you potentially may have a cephalosporin allergy and vice versa. So if somebody has already had an anaphylactic reaction to penicillin, you don't want to prescribe them with cephalosporins because they're most likely going to have a reaction to it as well. Penicillins are most commonly in general, the safe antibiotic for pregnancy and lactation, and overall cephalosporins are as well. So you could eliminate pregnancy if that was one that you were thinking about. The other antibiotics that we've gone over, remember, you do not give in pregnancy, like your tetracyclines, your sulfamides, your macrolides, um, but again, penicillin, cephalosporins are the ones that are commonly safe. But if they have an allergy, and more specifically anaphylaxis to penicillin, you don't want to give your cephalosporins. All right, I know I went on a rant with that, but that's something that I really want you to get ingrained in your mind because that's one of those common things. So if you see it, they like to commonly associate those things. For example, and these questions may seem very generic, but I'm big on if you learn the foundation, you'll be able to pivot in any direction that they give you questions in. So, for example, if they give you a question and it's a scenario and the patient is pregnant and they're looking to prescribe treatment, but the patient, might have had a penicillin allergy and you're thinking, hey, that's something that's safe for them, you knew you couldn't go with the cephalosporin alternative either because of the penicillin allergy. So having that knowledge that these two are so closely associated are huge little tidbits that I try different tactics on helping you to study it. And then you'll see these questions positioned a little bit differently. So I do it in the most specific knowledge base level, and then we start to add it into a format of applying it a little bit differently with scenarios. Okay. But all right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. It is in a paperback or ebook option. They're both linked in the bio of this channel. If you typically prefer to review independently or just want a review source to kind of just study on the go, I do offer a self-paced review all online, broken down by systems. It is linked in the bio of this channel. Our 5-week group review, the last one for this year, is currently um, in rotation, I should say. We started it on yesterday. The QBank, all of the QBank bundles and options are linked to the bio of this channel as well. And then if you're looking to do any one-on-one sessions, I always say just reach out by giving us a call or emailing us because all one-on-one sessions are customized. So they're gauged specifically for what you need. So I always say reach out so that we can determine what is going to work best for you and where you're currently at and your studying needs and preferences. So again, if you need any of the resources, feel free to reach out to us at the nursing studio, but y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.